Hi, I'm Dr. Kelly Starrett, and today we're talking about how you might use your H-wave if you've got some pain in your Achilles area. Now, Achilles tendinopathy, or pain in this Achilles area, is such a drag because you're a human being, you walk around a lot, and it turns out you're going to use that foot and that calf constantly. So you're going to be constantly reminded that you've got a sore Achilles. So how do we begin to untangle that sensitivity? Number one is we need to appreciate that the calf and the leg is always at the bottom of this gravity well. We're always going to be fighting swelling and congestion in this area. And if I'm not moving it because it's sore, it's even harder to pump that out. Enter the H-wave. One of the things we're always about is seeing if we can reduce congestion, swelling in that area. Can we dump the lymphatics? And it turns out congestion in a tissue will often be a rate limiter for blood flow in. So if we're going to heal this thing, we want to get the garbage out and we want to bring the groceries in. So I've got a simple setup that I want to talk about. Number one, I've got a pad under the back of the knee in the knee pit. And I've got one on my calf here. And then I threw one just on kind of right above the ankle. That's kind of thinking about the posterior tib. And I've got one on my shin here. Now, what is amazing is that I have some understanding of anatomy, but I've just moved the pads around until I got a solid contraction. The pad placement guide that comes with your H-wave will give you some good reference places to begin, but then you can just move around a little bit. I'm looking for a solid contraction. One of the things that happens when we're trying to pump the calf is that if I set myself up so that my leg is straight and there's a lot of tension in the system, you'll see that I'm not getting as much muscle activation. So I want to find a position that doesn't irritate the foot moving and allows me to get a solid muscle contraction. So I don't want to work against myself. I need to create enough slack in the tissue and enough sort of relaxedness that I'm not holding on and overriding the electric signal. So in this position with my knee slightly bent and my foot dangling off, I could continue to work or sit on the couch or hang out. And what we see here is that this can be done basically ad infinitum. You could pump for 20 minutes, amazing. 30 minutes, incredible. Got an hour of decongesting this Achilles, unbelievable. Sleep with it? Sure, absolutely. Get 1 or 2 hours. Every time I get a pump, and I'm getting 2 a second, it's like me taking 2 steps a second on this foot, which is actually pretty fast. So what's nice here is that I get a lot of contraction and a lot of movement without having to do a bunch of additional work. The key here is to be thinking about placement a little bit and also how you're setting this up. And really what we're thinking about is how and where can I get as much activity in this leg to desensitize and decongest this Achilles. Now, if ideally, I'd get a little bit in the morning, maybe a little bit at lunch, and in the evening. I want to spread that out. I could wait until I had massive amounts of swelling because I was in the car or at work and now I'm trying to dig out in the evening. Better off to see if I could spread that out. Again, one of my favorite things that we do with all of our athletes and teams is encourage them to pump overnight. Can we go to bed with the unit on and get many hours of pumping and then in the middle of the night turn it off? Here, of course, I'm just utilizing low frequency, getting a muscle contraction to dump the lymphatics. If we want to have pain-free, healthy tissues, we have to have a pain-free, healthy environment that starts with decongestion and blood flow.